Hi guys, Dr. Meg with Fix It Therapies. I want to talk to you guys this month about proper bike fit so that you do not get the pain and suffering that I'm seeing with quite a few patients. So today we're going to talk about 4 different ways that you can adjust your pedal and cleat interface use different parameters to make sure you have a proper bike fit, okay? So the pedal and cleat interface is one of the most important things to look at. So you look at it first when you're doing your bike fit, but typically the first one that I want to talk to you about is fore and aft position. So essentially your cleat is right here on your foot. For most people, it will sit in that metatarsal break, so essentially at the widest part of your front foot, and it will sit in the midline, okay? So halfway between your big toe and your baby toe, you're gonna put your cleat. However, if you're riding and you find out that you are starting to get quite a bit of calf pain or Achilles pain, so really on the posterior part of your leg, then you wanna think about moving this guy. So it probably is too far forward, so you wanna try moving it more backward for that. Now, if you typically you're getting a lot of arch pain in the foot, you also can adjust this and try to move it a little bit more forward. So that's one step. So fore and aft position having to do with the cleat position on the shoe. Okay, so the second portion that I want to talk about is position of your knee, your cleat and your foot being directly underneath your knee in your power position where you're doing the downstroke. Okay, so this means that you want to always have your foot position directly beneath your knee when it's in that bent position, ready to go into that downward pedal stroke. Okay, if you're looking in the mirror and you're assessing yourself, or you have somebody assessing you, or you video yourself and you find that your knee is medial to your foot, so your foot is outside your knee, you're going to want to bring your cleat more, you're going to bring your foot more medially, okay? Which actually means that the cleat portion goes more laterally. So again, if your knee is medial, you're not going to fix the knee. Instead, you're going to fix the foot and bring the foot more medial, okay? So my knee is inside my foot stroke. I want to fix that by making my foot go more medial. And to do that, we push this more laterally, okay? So push this more to the outside of the foot. The opposite is also similar for the opposite situation where you have the knee being outside. So now the knee being outside, the foot being medial, you want to bring the foot outside, so you bring you shift this closer to the big toe. Okay. The third parameter that you want to consider is your foot position and how it meets the ground. Now, some of the patients that I see will have a supinated foot or they'll have a pronated foot. Most of us have pronation feet, meaning we tilt more inward. We wear more on the inside of our shoes, our running shoes, or our cleats. But some of us do the people with the high arches that ride the outside of the foot. So you'll see that they'll get a lot of pain on the outside of the foot with cycling into the ankle, up the lateral side of the leg. So for these guys, you want to consider a wedge. And for the wedge, what you want to do is actually build up the portion that is lifted. So be able to support that side. So a person that has a foot that is more in that supinated position at rest, you want to be able to put a wedge with a thicker portion on the inside of the foot. Another thing that you want to think about is how that person is pedaling. And if you see that person pedaling and the knee caves in when you're in that downstroke, again, you want to probably raise that inside of the foot with a wedge. Now, wedges come in 1 degree per each wedge, so you can stack those wedges up. And when you place them, you want to place them right in that toe box, but underneath that metatarsal break, again with the thicker portion towards the big toe, if you're in that supinated position, okay? Building up the position that is the higher of the foot in normal rest. The final thing you want to consider with cleat and foot interface, pedal interface, is going to be angulation or rotation that you have within the cleat. So I would try to assess a person by looking at how much their feet turn in or point forward. So you can assess it while you're walking and see what your foot's doing if they angle out, or you can easily have a person jump and land and see how their feet naturally fall. I prefer the jump and land because it's a lot easier, and it's the most comfortable position for the foot. So ideally you want to be in a comfortable position for the foot when you're cycling as well. So if you have an angulation that goes out to the side, you're going to have to put your cleat on your foot to represent that. Now mine is just a straight up and down. So this is essentially, I'm working without a angulation. So I don't have any degree out to the side. If I did have a natural outward angulation, like a duck position, then I would have to move this appropriately here, where I would have this turn. So that is my new line of content, and that would be my angulation that I'd be cycling. I'd be rotating like this instead of rotating like this. Does that make sense? So this would have the capacity to be my new upward component instead of here. So to conclude, there are 4 parameters that you really want to think about with the foot and pedal interface, and it has to do with looking at fore and aft, so moving forward or back on the cleat, cleat forward and back on the shoe, or side to side on the shoe, or angulation with wedges. Okay, how much you supinate versus pronate in your natural at rest. And then the 4th one being rotation on this plane right here. So how much you toe out or are straight with your riding. All of these can make a difference, decrease the stress on the knee, and help you stay safe and strong.